All new this hour, insurance prices going up, and tonight a woman from McCook is worried about whether or not she can afford to keep her insurance. She has heart disease, and she says her new premiums for 2018 may be out of her reach. Channel 5's Frank McCaffrey spoke with her about how she plans to get by.
Obamacare health insurance prices are going up as much as 45%. A spokesperson at an Edinburgh Obamacare enrollment center, Jason Lester, tells us premiums here in the Valley are going up on most policies. Cheryl Keys says she already pays $296 a month for her individual health insurance policy. She says she's found out that will cost her more next year. Keys says her husband has his own insurance through his work. She's had her own policy for years. Her husband's income supports the household.
I don't work because I'm have to be available for my son. He's disabled and living in a group home, and so whenever the need arises, I have to be able to go, and work isn't conducive to that.
Keys battles heart disease and recently found out she was diabetic. These health problems add to her household expenses.
Like when I go to the doctor now, any blood work, any lab work done, I have to pay out of pocket, because the insurance doesn't cover that. It goes towards our deductible, and that's $7,000 a year.
Keys says she might have to make a drastic move with her insurance this year if she cannot afford premiums.
I'd probably just do without insurance and go just from doctor visit to doctor visit, and then if something major happened, well, then we'd have to figure out how to deal with it.
The Obamacare Center is privately owned. Lester blames the Trump administration's executive order on health care.
Since that was signed away, the insurance companies, they had to figure out how to make up that money that was being lost. So what they did was they increased the premiums.
Lester says the Valley has a lot of lower income families and paying high premiums is difficult. He says there is hope for them through tax credits.
Once they increased the premiums, what happened was it turned around and the subsidies increased as well.
Lester says the new laws are confusing for most, and he does the best he can to explain them. Lester adds subsidies could offset the rising price of insurance premiums for next year. Keys says she's planning to stay insured just as long as she can afford it. In the Channel 5 News studio, Frank McCaffrey, Channel 5 News at 6.
Open enrollment for 2018 starts tomorrow. This is a Channel 5 News Extra. This yearly period when you can enroll in a health insurance plan will run until December 15th of this year. According to healthcare.gov, after the open enrollment period, you generally can enroll in a health insurance plan, but this is only if you qualify for a special enrollment period.